A very good afternoon and welcome to our session on endometriosis and IVF. We are glad to have our Dr. Suyash Bhandekar who will talk about it briefly. The doctor will help us understand it in detailed. And if you have any questions, any doubt related to the topic, please write in the comment section. We are here to solve your queries, and our doctor is here to answer all your questions. So, doctor, you have the stage.
Thank you so much. I'm Dr. Suyash Bhandekar. I'm a fertility consultant at Apollo Fertility Center, Thane. So, with that, I'd like to go ahead with our topic for today, that is endometriosis and IVF. So, why I chose this topic is like recently I have seen a surge in this condition called as endometriosis. So, believe me, most of the patients here don't know what is endometriosis. So, if you talk about fibroids or a cyst or a polyp, in that case, yes, you still know about it. But yes, in case of endometriosis, there is still, I feel, there is a lack of awareness, and I feel this platform will be a better communication source with all of you. So, what is endometriosis? So, basically, endometriosis is like endometrium, that is the lining of the uterus that is inside the uterus, is present outside the uterus, like inside the fallopian tube, ovaries, or in the pelvic cavity, and that is causing you symptoms or the concerns. So, basically, it's like a very painful condition, and it is unfortunately not diagnosed very early. So there are like a multiple array of symptoms that can be seen. Almost 50-60% of the cases are asymptomatic. So that is the biggest problem. So we come across many patients who are having grade 3, grade 4 severe endometriosis, and they were completely asymptomatic. They always tell us, doctor, we have been asymptomatic. Then how come this condition came all of a sudden? So these cases do come up. So, if talking about the symptoms, it could be like just your painful periods. People consider periods to be painful as like a normal thing. Yeah, it is painful. So, almost 50% of the girls think it is okay, normal. It's every girl has pains, and this is also okay for me. But in this particular condition, the pain as such is very severe. The especially it has a typical
So we'll start the session again. A very good
Yes.
afternoon and welcome to our session on endometriosis and IVF. We are glad to have our Dr. Suyash Bhandekar who will talk about the topic briefly and help us understand it even better way and in detail. If you have any questions, any doubt, put in the comment section. We are here to solve all your doubts and all your queries. The doctor is here to help you. Doctor, you have the stage.
Yeah, thank you so much. First of all, a very good afternoon, everyone. Uh, I am Dr. Suyash Bhandekar. I'm a fertility consultant at Apollo Fertility Center, Thane. So, why I chose this topic is like I have seen a sudden surge in this endometriosis cases over a period of time, and unfortunately, the awareness is still lacking. So for example, if I say a fibroid or a polyp or an ovarian cyst, people still know about it. But endometriosis, yes, there is a lack of awareness, which I think this is a better platform which I can communicate with you all guys. So basically, what is endometriosis? So endometriosis is like whenever you get your periods, the endometrial lining is shed off through your vagina. But in endometriosis, there is certain portion of this lining is going back inside your pelvic cavity. So basically, the endometrium, which is lining the uterus, the endometrial cavity, this particular lining is not only inside the uterine cavity, but it is outside the endometrial cavity. That is your fallopian tubes, your ovaries, or your pelvic cavity, and that is causing concerns. And this is seen in almost 15 to 20% of the girls nowadays, and there is very serious surge into the cases, especially in cases of who are desirous of conceiving. So many of the patient comes over here in regards to fertility treatment, and we come across such patients here. So, what are the symptoms of this? So, they come with an array of symptoms. So, almost 50-60% of the girls are completely asymptomatic. They don't show any symptoms. But when we come across the diagnosis, so it's almost like a grade 3 or grade 4, that is severe endometriosis. And then the patient communicates with us, "Ki, Doctor, how is it possible? We don't have any symptoms also." So, this is, yes, this is seen. This is very unfortunate because the time lag is too high for that condition to present with some symptoms. The most common symptoms which I'll be talking about is like severe pain during a periods. So most of the girls think yes, pain during period is pretty much okay. Almost 60-70% of the girls do have pain, but this pain is too much severe, and they have a typical classic pain history that they usually say. So this pain usually starts right before the periods, like almost 7-8 days prior to periods. They have this pelvic pain, cramping pain, and once they get their periods, the pain is relieved. And again during ovulation, they have this pain, and whenever they're approaching their periods again prior to their dates, they have this 5 or 7 days prior, they get that severe pelvic pain, and which is very uncomfortable, especially when you get your periods. This is most of the time associated with a lot of bleeding also, that is menorrhagia. They have a lot of clotting also that is happening during that phase. Secondly, is they have pain during intercourse. So most of the girls say that they use a lot of lubricant, they try different positions and all, but still it is causing them a pain. And the thing is, they are actually not aware that this endometriosis component could be there, especially in your pouch of Douglas or the lower part of the uterus, where it might represent as the pain. Third is in case if your other organs are affected with this endometriosis, for example, your bowel, the intestines are affected, or your urinary bladder is affected with that. So you may have pain during urination or passing stools, or you may have some bleeding that is happening during passing of urine and stools. So these are some common symptoms, and the most common symptom that we fertility consultants come across is like they are not able to conceive. That is infertility. So they are usually couples who have all the symptoms, but they are like not that classical ones, but they have some minor component of each of them, and they may usually present with this fertility issues. So how do we diagnose it? So basically, diagnosis is pretty much clinical into this. We have come across many patients who usually complain with nausea, severe nausea, extreme fatigue, or they have this constipation, bloating, diarrhea during their periods. So this is a classical thing that we come across in cases of endometriosis. They have been mislabeled as inflammatory bowel disease or irritable bowel disease, and they're taking treatment for the same. But in that case, it is actually not IBD, that is inflammatory bowel disease. It is endometriosis, which is affecting the bowel. So most of the times, the case scenario is typically whenever we come to a diagnosis, it is mostly clinical. There are certain patients who come with a sonography report or a MRI report which is suggestive of a chocolate cyst, if you've heard of that, or an endometrioma, which is usually called as. So basically, the ovary is affected with that and it represents as a cyst. So usually they may say it is like a unilateral, that is maybe a left ovary is affected or a right ovary affected. But in majority of the cases, though it is not seen on the images, that is on a sonography or an MRI, whenever you put a laparoscope inside, both the ovaries, the tubes may be affected. So imaging plays a very important role. And third most common is a laparoscopy. So we usually do a diagnostic laparoscopy. So for we have many patients who are unable to conceive despite of everything. They have done multiple cycles of natural cycles and IUI cycles. They're not able to conceive. So and for a normal tubal check or a normal pelvic check, we usually suggest them to go for a laparoscopy. So during that particular surgery, we come across this endometriosis, which could be mild, moderate, or severe. There are many patients who are actually having moderate to severe endometriosis without any symptoms. So laparoscopy is a gold standard in which we can diagnose as well as correct that particular element to certain extent. And what are the treatment options that are available? So in case if it is only a mild endometriosis which is seen during a laparoscopy, there are certain spots, endometriotic spots over your fallopian tubes or ovaries or inside the pelvic cavity. We can just fulgurate it and we can still attempt giving you a natural cycle or an IUI cycle in which you can conceive normally also. The best part is whenever you get conceived, so like around 9 months of your pregnancy and around 5 to 6 months or a year of your breastfeeding, so those hormones are going to take care of your endometriotic symptoms. So they usually help you subside the endometriosis to certain level. Second is if you have a lot of like moderate or grade 2, grade 3 endometriosis, then you need a good clearance of that chocolate cyst or endometrioma, or if you have that spots wherever it is there in the pelvic cavity, your ovaries are completely plastered, the bowel is other end. In that case, you need a good clearance. And especially in such moderate to severe cases, we usually recommend going with an IVF. And for that, your pouch of Douglas, the other parameters should be cleared off. Your ovary should be accessible for doing an IVF also. Now, make sure whenever you're opting for a laparoscopic surgery for your endometriosis component, please choose a good laparoscopic surgeon who has adequate knowledge about this endometriosis. Because see, in endometriosis, the egg quality, especially your ovaries, are affected. So the egg quality is reduced. Your AMH is definitely reduced because of that. And we do not want a radical treatment into this. We do not want, if there is endometrioma, we have seen patients whose ovary has been removed completely or the tube is removed completely. We don't want that thing to happen because see, already your ovarian reserve is compromised, and if with the surgery, if you are removing a good part of your ovary, there would be further decline in your AMH. So we don't want that thing to happen. Basically, a good pelvic clearance, we should be clearing all the endometriotic spots. Maybe you can go ahead with some medical management to certain extent, but yes, a good clearance is always be going to be benefit for you. Secondly, there are patients who always ask us, Doctor, is there a medical treatment that is available for us? Yes, we have medical management also. Like we have this dinogestrel pill or combined pill which has dinogestrel into this. These work really well. And there is almost a 50 to 60% reduction in your symptoms overall. But these are like contraceptive pills, so we cannot usually give it to people who want to conceive, right? So in case if you have endometriosis and you are anxious to conceive, so I cannot give you those medical line of management. We have injections also which work really well. But yes, once you conceive, once you have a baby, and then you have this recurrence, then yes, we can always resort to this medical management with the help of medicines or injections which are available over the market. Now, coming to the end of this thing, my take home message will be this is actually a painful condition. Girls usually bear it to their maximum quotient. Please don't do that. Evaluate your pain, why this pain is happening. Secondly, it could be endometriosis. It's unfortunate thing is, even if we clear your endometriotic thing with the help of a laparoscopy, there is almost 50 to 60% chance that it might recur, and that is going to cause you a problem. So, in case if you have endometriosis, like a grade 2, grade 3, grade 4 endometriosis, please do not wait on your endometriosis to settle down. Try to conceive soon, because this is like till the time you have periods, this endometriosis is going to be with you. So you will have to accept it. That this is a part of your life. Yes, but we have solutions to it. We can provide you a solution for a better comfortable life. The only thing is, when you want to conceive, right? So conceive first, take proper treatment, conceive first. With the pregnancy per se also, this is going to give you adequate relief. But if not, we have other medical management that is available. And third is, most of the time it is undiagnosed, which has a latent period of diagnosis. So please go to a fertility consultant who may have this knowledge, and which who can help you out in this particular situation. With that, I would like to end this topic, and yes, whatever questions are there from your end, I'll be happy to answer to you. Thank you so much. Nikita, you able to hear me?